I'm Dan Sosnoski, Editor-in-Chief of Chiropractic Economics, and we're here at the Parker Seminars Las Vegas 2018 conference. I'm joined here today by Phillip. You're the Vice President of Sales for ClearGage, a patient financing solutions firm. And I wanted to ask you just some questions about that because our viewers are always interested in new and creative ways of arranging for patient financing.
Sounds good.
Yeah, it's a reality for most small chiropractic practices. One of the things I would just like to begin with is, what are some of the solutions available for creative patient financing?
Yeah. So you have your marketplace providers that are your primary sources that are usually a FICO-based scoring system for credit worthiness. Our model is a little bit different. We do a propensity score. We approve everyone. We fund that doctor up front for patients that wouldn't otherwise be able to apply or to gain credit through a marketplace lender. And it gives that doctor some additional options for financing to help patients.
Okay. And with respect to dual fee schedules and so forth, how can a doctor offering patient financing, how can that be done in a legal and compliant manner?
Yep. So for ClearGage, we're a little bit different than your marketplace lenders. We actually have a platform. We license our software to the doctor. The doctor is actually implementing or presenting a treatment plan to the patient, and that patient accepts the treatment plan. He's going to place that patient into our software, and we're going to manage that AR plan. The doctor has the option to sell that AR plan to ClearGage. So in essence, we're just buying receivables. Okay. So they're not applying for credit, we're buying receivables.
So if the doctor was to basically extend the plan to the patient, him or herself, then he or she would assume all of the risk. If they have you manage the plan, then you would basically take on that risk, and in consideration of that, you would take a percentage of the overall collections?
That's correct. So there's two options for a doctor within our software. They can manage an AR plan themselves, and we can help with that.
Right.
And they can receive 100% of the funding, or they can choose to sell that AR plan to us at a discounted rate based on that propensity score and the risk involved with that particular patient.
Okay.
So they have both options within the software.
And your software basically just calculates the propensity score or the risk assessment basically based on the patient's?
That's correct. So our propensity score is done through LexisNexis.
Gotcha.
It's a soft credit pull. It doesn't affect their credit score.
Gotcha.
And that's done automatically. And then they have options: 3 month, 6 month, 9 month, 12 month, all the way up to 36 month. The doctor gets to select with the patient which payment option works best for them.
Gotcha. Well, one last thing I'd like to ask you is, I know there are companies out there that basically work like, we are the patient financing firm. It's almost like they are giving the patient a credit card. Whereas in this model, the doctor has the option of giving the patient a credit card, more or less under his own practice title. What would be the advantage of a doctor assuming that role and not just completely pushing it off to a third party?
So the advantages for the doctor is a patient walks in and they're in pain most times, and they have the advantage to help that patient. A lot of patients are reluctant to apply for credit for a variety of different reasons.
Gotcha.
So the doctor now can extend an in-house plan without the patient applying for credit, which can get a little touchy sometimes.
It can.
So that would be the advantage of a ClearGage versus a traditional marketplace lender.
And if a doctor was to work with ClearGage, for example, that would not preclude that doctor from also working with other financing firms, right? I mean,
a lot of our doctors actually utilize Care Credit for the credit-worthy individuals.
Yes.
And for anyone that is either declined or for someone that's reluctant to apply through Care Credit, they can offer the in-house plan.
Interesting. Okay. So that starts to make sense when the CA or the billing staff sit down with the patient to discuss options. Now this is one more option that they have available. It might be the main option they have available, but at least it's good to be creative and to know that you have multiple solutions available.
In today's society, with the increasing patient responsibility becoming more greater as insurance starts to pull back, doctors should have more than one option available to make sure that they can help the patient completely.
Totally agree. Sounds good. Well, thank you, Phillip.
Thank you, Dan.